Hey, welcome to PTCB Prep Guide. This is where we break down all the tricky stuff you need to know for your exam into simple, clear guides. And today, we're tackling a big one, endocrine system medications. All right, let's just jump right in. And here's my promise to you. By the time we're done here, you are going to have a rock-solid grip on the key points that trip most students up. And you'll know exactly how to avoid the most common mistakes, not just on the test, but out there in the real pharmacy world.
So here's our game plan for today. First, we'll do a quick flyby of the endocrine system essentials. Then we'll dive deep and conquer diabetes medications. After that, we're mastering thyroid and adrenal drugs, and we'll wrap it all up with some other key hormones and the big technician takeaways you absolutely need to know.
All right, so first things first, endocrine system essentials. Look, you gotta understand the basics of how this whole system works. It's really the foundation for figuring out why these meds are even used in the first place.
So, what is this system anyway? Well, think of it like the body's internal Wi-Fi network. Seriously, it's this whole network of glands, and they're constantly sending out these little chemical messengers called hormones. And these hormones, they control pretty much everything. Your metabolism, your growth, and just keeping everything inside you stable and balanced. You know, that state we call homeostasis.
Okay, so with that foundation in mind, let's jump into our next big topic, conquering diabetes medications. And I'm not kidding, this is probably the biggest, most heavily tested area within the endocrine system. So we're going to take our time and really break it down piece by piece.
Okay, so it all boils down to one key difference you have to know. With type 1, the problem is simple. The factory is closed. The pancreas produces zero insulin. So what's the fix? Well, you have to replace it. No other choice. But with type 2, it's different. The pancreas is still making insulin, but the body cells are just ignoring it. They've become resistant. And that's why we can often start with oral meds. They help the body get better at using the insulin it's already got.
And that brings us to insulin itself. Now, this chart, it's absolutely critical. You can see we've got a whole range of insulins here. You've got your rapid-acting ones like Lispro that kick in super fast, like within 15 minutes to cover a meal. And then on the other end, you have the long-acting ones, like Glargine, that work in the background, providing a steady dose for a full 24 hours. And listen, these onset and duration times, they aren't just random facts to memorize for the test. This is all about patient safety. It's what prevents those dangerous highs and lows in blood sugar. So for you, as a technician, what does this all mean? Well, here are the absolute must-knows. Always, and I mean always, double-check the insulin type and its concentration. Second, unopened vials, they live in the fridge. But once a vial is opened, it can stay at room temperature for up to 28 days. And here's the big one, the one you can never forget. You never substitute one insulin for another without getting the okay from the prescriber. That is a massive patient safety issue. All right, let's talk about the oral meds for type 2. Now, I know this table looks a little intimidating, but just focus on that mechanism column with me for a second. See how each class has a totally different game plan? You've got metformin, which basically tells the liver, hey, chill out, stop making so much sugar. Then you have the sulfonylureas, like glipizide, which go over to the pancreas and kind of nudge it, saying, come on, let's release a little more of that insulin you've got stored up. Every class has its own unique way of tackling the problem. All right, time for a quick mini check just to make sure that's sticking. Go ahead and pause for a sec. Which drug class that we just talked about works by poking the pancreas to release more insulin? Got it? If you said sulfonylureas, you nailed it. Awesome job. Okay, let's put up a couple of big red flags here. Major technician alerts. First, metformin. It's the #1 go-to drug for type 2 diabetes. But it's a hard no for patients with serious kidney issues. That's a huge one to remember. Second, sulfonylureas. These have a pretty high risk of causing hypoglycemia, that's low blood sugar. And that risk shoots way up if the patient is also on insulin. That combination is something you've got to be super careful with. Okay, great job on diabetes. Now, let's totally shift gears and move into section 3, mastering thyroid and adrenal drugs. The story here is pretty simple, actually. It's all about either replacing hormones that are too low or controlling hormones that are too high. And this is a perfect way to look at it, the two opposite sides of the thyroid coin. On one side, you have hypothyroidism. Think hypo meaning low, too little hormone. The body's metabolism just grinds to a halt. Patients feel sluggish, they gain weight, they're always cold. Now, flip the coin. you've got hyperthyroidism. Hyper means high, too much hormone. Now the body is revved up into overdrive. We're talking weight loss, anxiety, a heart that feels like it's racing and always feeling hot. See how they're perfect opposites? That makes it so much easier to remember.
Which brings us to levothyroxine, brand name Synthroid. You guys, this is one of the most prescribed drugs, period. So these 3 points are pure exam gold. Number 1, it has to be taken on an empty stomach. First thing in the morning is best. This is all about absorption. Number 2, you got to keep it away from things like calcium, iron, and antacids by several hours. They'll literally grab onto the drug and stop it from working. And number 3, if you see DAW dispense as written on that script, you have to give the brand name. Tiny differences between generics can really mess with the patient's levels, so this is non-negotiable. And you know what? The adrenal glands follow that same pattern. It's another case of too little versus too much. So too little is Addison's disease. The body just isn't making enough cortisol. The fix? We replace it with a corticosteroid, like hydrocortisone. Too much is Cushing's syndrome. Now the body is flooded with cortisol. And a lot of times, this is actually caused by the medications we give patients for other things, like high-dose steroids for asthma. So the goal there is to find a way to safely and slowly lower that steroid dose.
All right, we are in the home stretch. Let's hit our final section. We're going to cover a few other important hormones, and then, most importantly, we're going to pull everything together into a neat package of technician takeaways for the exam. Okay, let's do these rapid-fire style. Ready? Contraceptives. The big one to know is the risk of blood clots. That risk is even higher for smokers. Testosterone, it's a C3 controlled substance. And with the gels, you have to warn patients about skin-to-skin contact with other people. Super important. Finally, somatropin, that's growth hormone. One word, refrigeration. It has to be kept cold. So how do you take all this and use it every day at work? Simple. Use this 5-point endocrine check every single time. 1. Know the brand, generic, and class. 2. Check the storage requirements. 3. Look for key auxiliary labels. 4. Know if it's a controlled substance. And 5. The golden rule we've talked about. Never, ever, ever swap out insulins or thyroid meds without the prescriber's direct okay. And here you go, the whole shebang on one screen. This is your ultimate recap table. Think of it as your cheat sheet. We've lined up the disorder, like type 1 diabetes, with its main drug, insulin, and the reason it's used, replacement. Use this to cram right before the exam to lock in all those connections. Whew, we've covered a ton of information, right? But this isn't just about memorizing facts to pass a test. It's about patient safety. So I want to leave you with this question to think about. Now that you know the what and the why for these powerful medications, how are you going to use that knowledge to be that final checkpoint to ensure your patients are safe every single time? I really hope this guide helps you feel way more confident tackling the endocrine section on your exam. If it was helpful, do me a huge favor. Like, subscribe, and hit that little bell so you don't miss our next prep guide. Oh, and don't forget to test yourself with the Quizlet link down in the description. Next up, we are taking on another beast, cardiovascular meds. I'll see you for that one.